Hello, my name is Mohammed Aziz. You can call me Aziz, and my group mates are Jun and Shabil. Today we are going to give our presentation about hepatitis. Well, what's hepatitis? Next, please. Next slide, please. Hepatitis is an inflammation of the liver tissues that causes damage to the liver. The liver is the largest organ inside the body, and the liver performs many critical functions that aids metabolism, includes detoxification of blood, production of bile that is important for digestion, and storage of glycogen. This liver process can be disrupted by hepatitis, creating severe health problems throughout the body. Hepatitis may be acute or chronic depending on its duration, whether it lasts for than or more than 6 months. Acute hepatitis may often result on its own progress to chronic hepatitis. With time, the chronic form may advance to liver damage, cirrhosis, liver failure, or liver cancer. Most hepatitis is caused by viruses and it's classified as hepatitis A, B, C, D, and E. The three most common are hepatitis virus, R, A, B, C. An infection with any of these three can be fatal. It was reported that hepatitis A affected about 114 million people, and chronic hepatitis B occurred in about 343 million people, and chronic hepatitis C about 142 million people worldwide in 2015. Now, June will talk about how does it happen.
How does hepatitis happen? Hepatitis means inflammation of the liver. The liver is a vital organ that processes nutrients, filters the blood, and fights infection. When the liver is inflamed or damaged, its function can be affected. Heavy alcohol use, toxins, some medications, and certain medical conditions can cause hepatitis. However, hepatitis is often caused by a virus. Hepatitis A is spread when a person ingests fecal matter, even in microscopic amounts, from contact with objects, food, or drinks contaminated by feces or stool from an infected person. Hepatitis B is primarily spread when blood, semen, or certain other body fluids, even in microscopic amounts, from the person infected with the hepatitis B virus enters the body of someone who is not infected. Hepatitis C is spread when blood from a person infected with the hepatitis C virus, even in microscopic amounts, enters the body of someone who is not infected. And that's about how does it happen. Who are most vulnerable to the disease? The range is very broad. There are a lot of people who might get the disease. Healthcare workers who suffer needle stick accidents, and all children at age 1 or older children who didn't receive the childhood vaccine, infants born to infected mothers, people who inject drugs or share needles, syringes, and other types of drugs equipment, sex partners or people with hepatitis unprotected, people who live with someone who has hepatitis, who have shared toothbrushes and other personal items with a family member that is HCV infected. That's all about who are most vulnerable to the disease. And now Shabil will talk about the prevention and treatment of hepatitis.
Hi there, my name is Shabil. I will talk about the preventions of hepatitis. So here are many ways. There are many ways you can reduce the chances of getting this disease. Firstly, you can get a vaccine for hepatitis A and B. You could also use condom during sex. Um, you cannot share needles when taking drugs, any drugs, basically vaccine or anything. You should practice good personal hygienes. You should wash your hands with soap uh, often, and then you should prevent yourself from using an infected person's items. Uh, you can take precautions when getting any tattoos or body piercings. Take precautions when traveling. Sanitize yourself a lot. Um, and then lastly, you should drink bottled water when traveling. Use less. I say this cups. Yeah. So here are the treatments for the hepatitis. Firstly, there are no treatments to cure hepatitis A. However, they meaning the hospital will thoroughly check your liver functions. And then for hepatitis B, when chronic, can this when this happens, this can often be treated successfully. And here are the most commonly used drugs to treat this disease. Entecavir, talbibudine, tenofovir, alafenamide, and the list goes on. For hepatitis C, the following drugs are used. Um, these are all vaccines. Yeah. And then lastly, if you have chronic hepatitis D, mostly your doctor may prescribe drugs with interferons, and they will also add medicines for this disease. And hepatitis E treatments include PEG interferon, alpha 2A, and ribavirin. And that is all for my part. Thank you. And then